Medicare for All, right? Bernie Sanders has been pushing that since God was a teenager. Elizabeth Warren also is pushing it. What's his name? Bloomberg is saying, well, okay, let's build on Obamacare, but we'll also have a public option. Buttigieg is, I don't know what's he saying about health care. I have no fucking idea. I really don't care what Buttigieg is saying. But this is from Newsweek today. The Medicare for All plan proposed by Bernie Sanders and Elizabeth Warren would save taxpayers hundreds of billions of dollars each year and would prevent tens of thousands of unnecessary deaths, a new study shows. Okay, where's the study come from? The Fox sewer? The analysis conducted by researchers at Yale, the University of Florida, and University of Maryland, how's that? Found that transitioning the U.S. to a single-payer healthcare system would actually save an estimated $450 billion each year. That, dear friends, is almost $500 billion each year, with the average American family seeing about $2,400 in annual savings. The research, which was published Saturday in the medical journal The Lancet, also found that Medicare for All would prevent about 68,000 unnecessary deaths each year. Allison Galvani, an author of the study and a researcher at the Center for Infectious Disease Modeling and Analysis at the Yale School of Public Health, she told Newsweek, quote, "Our study is actually conservative because it doesn't factor in the lives saved among underinsured Americans, which includes anyone who nominally has insurance but has postponed or foregone care because they couldn't afford the co-pays and deductibles." End quote. Now, Kathy and I know about this, as you know, because she made it very public. She had cancer surgery. Bladder cancer surgery. And her physicians had gotten it early enough that they had told her it's gone. And the results of that surgery was sent to Sloan Kettering for analysis, and they agreed. Okay. Kathy had, I think, 3 or 4 chemo treatments afterwards, a different kind of chemo, not a drip, and is due for another exam to see if it stayed gone coming up in a couple of months. The reason I mention that is because, we have good insurance, good health insurance through SAG-AFTRA. My SAG-AFTRA insurance covers her and Molly and me in addition to, my Medicare. But Kathy just had to write $7,000 in checks to pay off our co-pays and deductibles. $7,000. Now, that's not a lot to pay when somebody is cured of cancer, for Christ's sake. I'm not talking about, I don't think it's fair. Of course it's fair. But if we had single payer, which is what I have with Medicare, I have single payer health insurance. And then I have supplemental through SAG-AFTRA, which covers Molly and Kathy. But if everybody had, and I have a slight, deduction, but that's why I have secondary insurance to pick that up. But I think, what if we did not have the health insurance necessary to have covered what Kathy went through? That was the one thing that she didn't have to deal with while she went through the diagnosis, the treatment, the prognosis, the drugs. One thing she did not have to deal with was how in the fuck are we going to pay for this? Because the bills were pretty high. But we did have to pay that $7,000. And Medicare for All or single payer health care would fucking eliminate that. We would all have, the way Medicare works, you have payroll deductions. It just comes out of your paycheck over the years. You pay into the Medicare fund. I'm simplifying, but that's about what it amounts to. And then when it's your turn to receive Medicare, yes, you have a deduction. Yes, you have a copay. But compared to the kinds of bills that you can face when you hit the last trimester of your life, Medicare for All certainly makes sense, doesn't it? Overall, let me go back to this piece in Newsweek. Overall, you didn't mind my mentioning that, did you? Okay. Overall, the new research anticipates annual savings about 13% in national health care costs while providing better health care access to lower income families. You know, it's rough enough, I'm sure. I grew up poor as a motherfucker. I mean, you know my story. But that was, back in the 40s and 50s where I don't know, probably half the population of the United States was considered poor or working poor. But now, here in the 21st century, to be poor with the way advertising assaults you, if you don't have a certain look or go on certain vacations or drive a certain car or wear certain designer clothes or this or that or this other bullshit, it adds to that ugly fucking pressure that's made everybody in America miserable. It adds to. It's not the sole cause. But if you're a lower income family, not only do you have to suffer through that shit, but you know fucking well that if you get sick, if your children get sick, what are you going to do? You don't have health insurance. Or if you do, you have some rat fuck policy that has a $5,000 deductible and maybe a $100,000 limit of services. Christ, $100,000 is about what it costs to have your appendix out these days, isn't it? So Medicare for All would take that away from lower income families that are fucking struggling psychologically, emotionally, probably spiritually, with being on the bottom of the fucking ladder in this capitalist pighole society. According to the study, about 37 million Americans do not have health insurance, while an additional 41 million people do not have adequate health care coverage. So that's 78 million Americans. Taken together, the article goes on, about 24% of the total population does not have health care coverage that meets their needs. Why the fuck not? The health insurance industry that is doing everything it possibly can, some of it overt and out in the open, some of it in the shadows. They're doing everything they can to destroy Bernie Sanders and Elizabeth Warren for that reason alone. Single-payer health care. Because these fucking bastard parasites in the health insurance industry make billions of dollars on death and sickness and disease. And the dirty son of a bitches, they sell you a policy, and when it's time for them to pay up, well, I'm sorry, sir, that wasn't covered. Well, I'm sorry, you have a pre-existing condition. Which is something that Kathy is going to have to face for the rest of her life. Well, Mrs. Malloy, you have a pre-existing condition. Didn't you have cancer? And you want us to insure you? And what about my daughter Molly, our daughter Molly? Didn't your mother have cancer? Well, honey, you see? Now, those are our stories. You have your stories. You have the shit that you have to face. I don't care what your income level is. You have the problems that you have with health care insurance, health insurance coverage. Anyway, the article goes on to say the entire system could be funded with less financial outlay than is incurred by employers and households paying for health care premiums combined with existing government allocations. The authors also noted, as Sanders does when this comes up, that all healthcare expenditures in the U.S. are higher per capita than in any other country. And you know why? Because we put up with it. Just like we put up with Trump. What the fuck is wrong with us? Josh Bivens, research director at Economic Policy Institute, who was not involved in the study, told Newsweek this, quote, "It is worth noting the absolutely staggering differences in prices for health care paid in the U.S. relative to our rich country peers. Given this, and given that other countries largely control these costs by centralizing them, it seems to me that the by far most likely development would be for national health costs to fall under a single, well-managed Medicare For All plan," end quote. And of course, Sanders has been saying this for years. His plan would guarantee, quote, "health care as a human right." Hi, Truth Seekers. Mike Malloy here. As you know, we've switched formats and are now broadcast exclusively on the Progressive Voices Network. So that means you get fewer program interruptions, no corporate commercials, and lots of profanity. But our format change also means some of our radio listeners no longer hear the program. It's been a while since I mentioned our podcasts, so you may have forgotten that there is a way to listen to this program anytime you need a good dose of screaming. Visit MikeMalloy.com and subscribe to our podcast. You have your choice. You can listen to the ranting with the audio podcast or listen and watch me lose control with a video podcast subscription. As a podcast subscriber, you can download the program to your mobile device and take me with you wherever you go. And if you have a friend who needs a dose of truth-seeking, you can give a gift subscription as well. That's MikeMalloy.com. And never miss a minute of the uncensored fun and frivolity.